So I'm going to start with a story. This is our family, and between Greg and I, we have 6 kids. But the two on the left are 15 years old. This is Owen and Dutch. And many would say that this is a really important time in a teenage boy's life because they're learning to drive. But this story is about Dutch, because when we brought him to the DMV to get his learner's permit, he failed the visual acuity exam 3 times, and they told us he would not be leaving with his permit that day. So this was pretty devastating for him. And it was for me as a parent to see him go through this. But when we brought him to the eye doctor to get an exam, he actually tested at 20/60 in both eyes, which I don't know if that means anything to you. It didn't to me, but basically everything below that green line was blurry. So embarrassingly enough, my father is an ophthalmologist, and I called him. And he said, I felt so badly about this. And he said, Jill, don't feel badly about it, because Dutch was operating under what's called house vision, which essentially means that your brain has enough information that it fills in the rest of the details for you. So these are real photos from the following week when we picked up his glasses, and this happened this summer. So this was quite an experience for him, and we heard about it over the next several days. He would ask us things like if we could see the leaves on the trees in the distance, or he made us all try on his glasses too, thinking that possibly they would help us see better as well. And then he said something that was surprising to me. He said, I feel that I now have an unfair advantage. So this really resonated with me, because this is how I feel every day in practice using a dental operating microscope. So magnification is a standard today in dentistry. And if I ask this audience how many of you are currently using magnification, probably everybody would raise their hands, or most of you. But what if I ask you how many of you are currently using a 4-power or greater? Can I see? Okay, like a really large number. What about a 6-power or greater? So the number went down a little bit. So I'm curious, how many are using a dental operating microscope? So there's a good number here, but still really low if you look around. So why is that? Is it that we think it's too difficult, or it's not worth it to learn how to use it, or that we'll lose our perspective maybe? Or maybe it's the cost, because they're expensive, right? Or maybe it's a little bit of this. So I know every dentist is here for professional advancement and growth, but I've had some people say to me, I really don't want to see my work up close. So I feel that every dentist should be using a microscope. So I'm going to challenge the ideas that you have around it. I'm going to share with you a little bit about my personal journey, some of the benefits that the microscope can bring to you in your practice, and then I'll address the challenges that you may be thinking about as well. So why the microscope, and why am I so passionate about it? I graduated from dental school, and when I came out, I was already dependent on magnification. See, we were dispensed these flip-up magnifiers our first year in school with our student supplies. I don't know how many of you had those, but they didn't last long. Most of my classmates advanced to loupes by the time we entered the patient clinic. So mine were similar to these. They were 2.6 flip-ups, and this is how I learned to see patients. But shortly after dental school, I had an opportunity to work in a practice as an associate, and that had microscopes hanging in every operatory. And I had never seen anything like this. The only microscope that I'd ever seen was in the endo grad clinic, and it was reserved only for the residents. So my first procedure ever was an endo access on an extracted tooth. And I think I felt a little bit like our son Dutch, actually, looking through his glasses for the first time. Not only was I surprised at what I was seeing, but I was just shocked at what I had been missing, and it concerned me. But it wasn't to the point where I just jumped right in. I tested the waters a little bit. I started with observation. So you may be wondering what exactly this means. For me, it was pretty much doing everything I normally did. I'd prep a tooth to the point where I thought it was complete, but then I'd pull the microscope over and just see how I did. And then I'd push it aside, and more times than not, I'd go back and modify. But what I saw was that this was allowing me to go beyond what my loupes had. And this observation, there were some changes that were continually happening because of it. So I did decide to jump in and decided to test this out. I started with really simple procedures, either anything outside of the mouth or anything in a direct line of sight. So it took about 18 months of really being committed to this, and I don't know what exactly changed. It was my confidence and that feeling like I had some intention in it, but all of a sudden it was as if really dentistry changed for me and it became fun. And I just saw the improvements that it was allowing me to provide for the patients in terms of the outcome. So why am I so passionate about the microscope in dentistry? I would say now, with 20 years of experience, looking back, it's the one piece of equipment that has most transformed me as a dentist. It's most transformed my practice, and it continues to change what I do every day. All right, so we're going to dive into some benefits here. I'm going to touch on these three: visibility, precision and accuracy, and then ergonomics. So by visibility, I'm referring to a broader range of sight, or the ability to see more, because of two things: magnification and what's called a coaxial light source, which means through the lens. So when I dove into the literature to see what it said about magnification and range of sight, I found this study published 2 years ago by a Swiss group. And what they did is they looked at visual performance and compared the naked eye to loops to the microscope. But they particularly looked at two age groups, both before and after the age of 40, when presbyopia sets in. And you can see from this graph here that hands down the microscope is absolutely the winner. But what was really interesting about this study was that it compared loops to the microscope, the loops at a 4.3 to the microscope at a 4, and even still, it provided better visual performance and range. So what can we actually see with the human eye? Gary Carr, very well-known endodontist, he published a study back in '98 that is still well quoted today and referenced, but he compared basically the unaided human eye to loops and the microscope at various magnifications. And what they found was that even with perfect vision, that the human eye cannot detect an opening smaller than 200 microns. But it also showed that if you went to an 8 power, that you improved that to a 25 micron, or improved it by 85%. So what does this look like? Okay, these are magnification steps under my microscope. This is a 2.3. This is where I was coming out of dental school. And a 4, just to reference where you are. And here, this is a 4. And many have gone to even an 8. So my happy place starts at about a 10. This is where I live, between 10 and 16. But my scope goes all the way up to a 22. And sometimes I have to use it for diagnosis in particular instances. So the question is, if you could see more, would it actually change what you do? So this is an example of a patient that came in. Here. This is an example of a patient that came in with a fractured palatal cusp, number 13, entirely off. And I didn't take pre-op photos, so I don't have those to reference in this, but I was getting ready to pack a second cord for an impression, and I noticed you probably can see it here because this is a 16 magnification, but a fine little line on the palate on the side there. So I bumped it up to a higher magnification just to see what was going on. So there's a vertical fracture there that extended 4 millimeters down the root. We were planning on doing an all-ceramic crown. You know, had I stuck with that plan, it would have definitely resulted in a problem for the patient down the road. So this changed our diagnosis. It changed the decision around what to do. Another thing I love about visibility is the access it allows. So I'm talking about the dark corners of the mouth and the small spaces. I know I can't be the only dentist in this room who's struggled to remove decay off of an upper second molar or interproximal and lower anteriors, but having access definitely allows you to get to places that otherwise could be challenging. So just to recap on visibility, I believe it provides access, improved diagnosis, and improved decision-making. And I love this quote by Bob Winter: "Rather than what you think you see, magnification is the reality, since you are seeing what actually exists." All right, so we're gonna go on to precision and accuracy. These two terms are often used interchangeably by people, but they actually have very different meanings. We learn them in basic chemistry. So accuracy refers to how close you are to your intended objective, while precision refers to the variability that you see when the act is repeated. But you can actually be quite precise and not accurate at all, or like me playing darts, neither. But really in dentistry, this is what we're after, both precision and accuracy. And literature, not literature, research has proven that increased magnification is directly correlated with improved motor skills, manual dexterity, and what's called servo. And this is electrical engineering term. It refers to what our eyes register, the brain registers, and the feedback it gives to our hands so we can actually do something. So I'm going to go through some examples, both indirect and direct here, in ways that this applies. So we're going to start with direct, and I'll touch on these four here really quickly. The first is impressions. So I love using the scope just to evaluate impressions before I send them off to the lab, to look for debris, holes, air bubbles, anything that would interfere with accuracy. Second is indirect restorations when they come back from the lab. So about 85% of the labs we work with, they all use magnification like this. So why shouldn't we have it, when we're receiving the restorations and bringing them back to the patient's mouth? Just so you can see, in this example here, where there's a short margin, it's good to know that when you're bringing it to the patient mouth where you may have some trouble. The third is provisionals. So I trim all my temporaries under the microscope. I love it for this, not only for refinement of the margins, but managing interproximal units when they're splinted like this. And it allows for managing surface texture and polish, and all these things lend to tissue health and help us when we transition to final. And the last is implant components. I love using it for this indirectly. This is just walking through the steps on my microscope here, but you can see how managing implant component cleanliness is definitely a benefit, when you can see at this level. I also use it with implant abutments, both temporary and permanent, modifications. All these things are, wonderful to have that higher magnification for. All right, so now I'll touch on three direct applications of this. So when you prep a tooth, how many things do you have to manage or navigate around to manage that cavous surface margin? The number is really quite high, but all these things affect our accuracy and the precision of what we capture for the lab and what we get back. And you can see that that's also going to determine, the accuracy of what we have in terms of the restorations that will provide for healthy tissue support as we go into final restorations here. The second is the tooth restorative interface. We have a tough job as dentists. We have to match up man-made materials to the natural substrates of the mouth, and it's not an easy job. Not just so that they look beautiful, but so that they function and have longevity and predictability. And a lot of people think when they hear that I'm a microscope dentist that I'm minimally invasive, which is wonderful, and I love that about it. But I like to think of it more as minimally destructive because it allows me to manage the soft tissue and hard tissue, less trauma, less morbidity. And we all deal with the challenge of iatrogenic trauma. And research has shown that 40 to 60% of adjacent teeth happen to be damaged during dental work. So just to recap on that, I believe that the precision accuracy lends to quality, predictability, and reduced trauma. Okay, ergonomics. I have to touch on this because this is the #1 reason why people approaching me and ask me about the microscope today. They're either dealing with some sort of neck or back pain, where if they don't do something, it's going to shorten their career. So I love it for this. It is wonderful. It allows you to sit in an upright position with passive neck posture, with less strain on the cervical vertebrae and the back. But the bigger advantage that I see is that it provides stereoptic vision, or parallel line of sight, reduces the strain on the eyes and the compensation by the brain, as opposed to converging vision associated with shorter working distances and loops. So these are the three benefits I touched on, and I'm actually going to give one more here. Many of you have heard Frank talk about the Doppler with the new patient exam. And one of the wonderful things about the Doppler is that it creates a unique patient experience. So we all have this in our practice, our version of the Doppler and what that looks like. For me, the microscope has been my Doppler because it's allowed me to create that unique experience, but it's also allowed me to document and educate the patients as well as build value and trust for the dentistry. So now it's time to get real. because using this equipment comes with some challenges. So let's talk about them. So the first is learning curve. Doesn't this just make anything new or learning challenging, you know, the learning curve? I'm not gonna lie, it made the initial journey quite rough. You've all probably heard of Malcolm Gladwell's theory from his book Outliers, that it takes 10,000 hours of practice to become an expert. So I don't think it's gonna take you 10,000 hours if you choose to pursue this, nor do you necessarily need to be an expert. But I do think that the key is that we need to stay committed to the process of whatever we're trying to learn, and be patient with ourselves in it. So some things that helped me along the way, there's some wonderful training centers across the country that cater to this sort of thing. But even here at Spear Education and all of the advanced workshops and the restorative design workshops, there are 4 microscopes in the back of the room there. And if you request them, you can use these during your advanced workshops. They're limited, so you do need to request that, but they are available. All right, workflow. So every time I return from continuing education, I think my team braces themselves a little bit to see what's going to change and whether or not it's going to stick. So this was no different, really. I think really the key here is identifying what the barriers are and then making changes. So for me, it was building value for it and educating them on it, and then rethinking some of the systems we currently had in place. An example is that the microscope, when I first got it, it was installed in a cabinet between 2 operatories. So you actually had to open the cabinet to get it out and move it to either side. So one thing that we did was I said, I want it ready to pick up, just like a handpiece for every procedure. I want it as easy to grab as that, and that seemed to help in our situation. But I do think you need to identify what those things are that are standing in the way of new technology being implemented or new systems. All right, the last is the cost. And back in the early 2000s, when I first bought my microscope, it was about $18,000 to purchase and install. And I had just bought my own practice. Equipment like this was not really easy to justify. You know, what I have found though is I think the key to really any of this is knowing and only owning the value. And we deal with this every day in dentistry because the price tag stands in the way of a lot of our patients committing to treatment. And this seems to change once they know and own that value. So I think this is very similar. I will say that the microscope is the most valuable piece of equipment in my office, and it's not because of the cost. It's because of what it's allowed me to do. Not only just provide a higher quality of dentistry, but it's built trust and loyalty to my team and my patients, and it's helped me build a reputation in the community as well as referrals. So absolutely worth it. So I'm going to close with a story about this man here. This is Dr. Peter Janetta, and Dr. Janetta is a neurosurgeon, and he performed the first decompression surgery on a patient with trigeminal neuralgia back in 1966. So I had the privilege of meeting him in 2006, and he has since passed away. But what impressed me most about him was not his amazing surgical skill. It was actually a story that he told. So Dr. Janetta would travel around from hospital to hospital with a microscope in the back of a pickup truck just so that he would have it for his procedures. And I believe it's because of pioneers like Dr. Janetta and his commitment to progress that microscopes are a standard in neurosurgery today. So we're at a really interesting place and time in dentistry with technology and a lot of change. It's moving us to really exciting places, and part of that is our commitment to it. You know, it might be that the microscope is this unfair advantage, but really, I believe that higher magnification raises a standard of care that patients can and should expect from us in dentistry, not just in the future, but today. And as part of the Spear Education community, all of you are here because you're committed to growth and to constant improvement and setting yourselves apart from others. You know, and I'd like to suggest that maybe higher magnification is part of that journey to excellence. And as Frank says, you can only treat what you see, and you only see what you know, and seeing is a huge part of that. Thank you.